The 12th season of Consider This is brought to you in part by From the Top, a national program showcasing the musical talents of young people. From the Top can be heard on KVNO Classical 90.7 each Saturday at 6 p.m.
Consider This, a program of issues and information behind today's news. Once again, from the campus of the University of Nebraska at Omaha, here is your host, Kathy Wyatt.
President Obama addresses the nation on one of the hottest topics in Washington. Hi everyone, I'm Kathy Wyatt. Welcome to this week's edition of Consider This. Our topic, healthcare reform. Here to talk more about it are Dr. Richard O'Brien, who is with Creighton University. He is also co-chair of the Nebraska Medical Association's Healthcare Reform Task Force. Jane Klebb, who's with the Nebraska Alliance for Healthcare Reform, and former State Senator Pat Bourne, who is now with Blue Cross Blue Shield of Nebraska. Thank you all so much for joining us. Welcome.
Thanks for having us.
Pleasure to be here.
Dr. O'Brien, we're going to start with you. We actually have a graphic that kind of spells out what healthcare reform is really designed to do. If you could walk us through that, that would be terrific.
Well, we want to increase population coverage to be sure that everybody in the country has access to healthcare coverage, to expand the array of providers to meet the needs of people who live in areas who are not adequately served, or to meet the needs of people who don't have adequate access to primary care, to improve access to specialists when needed, certainly to improve the quality of health care, and one of the most important things is to decrease the cost of health care.
Okay, and when it comes to President Obama's plan, there are really three promises that he's making, and we have a graphic to show the viewers that as well. So if we could go to that. Three core principles here: reduce costs, guarantee choice, including a public option, and ensure quality care for everyone. I'm curious as to all three of your opinions on those promises that are being made. Dr. O'Brien, we'll start with you.
Well, I think the promises would fulfill the criteria that we had set up before. For example, he says quality care, that's quality for everyone. That's essentially universal coverage to the extent it's possible, and then of course cost control and access to the kind of care that's needed. So I think those three principles cover what the main goals of healthcare reform are and ought to be.
You think they're realistic based on?
I certainly hope they're realistic, because if we don't do those things, we're going to end up with the same system we have, which is a system that's getting worse. It's costing more people more money. More people are being priced out of health care. People are going bankrupt because of health care. Primary care providers are sparse in many parts of the country. I don't think anybody wants to keep the system the way it is.
Okay. Jane, your comments?
I think affordability is one of the biggest things that all the groups that make up the Alliance are focused on, and that's Cancer Society, SEIU, AARP, and the Center for Rural Affairs, and Nebraska Appleseed. All of these groups work with different populations, but the biggest concern of Nebraskans is we need affordable health care. Right now, Nebraskans spend about $12,000 to $14,000 a year on health care, and if we don't reform the system, that's going to go up to $23,000 in just a few years. And so that's just not sustainable for any family. And when we say affordability, we're really talking about, we want to see something that comes out of Congress that when we're paying for health care, both in the premiums as well as out-of-pocket costs, that's no more than 10% of a family's income.
Okay, thank you. And Pat?
Blue Cross Blue Shield, we support healthcare reform. I'd say we support about 90% of what the president's recommended. We don't, however, support the government plan or the public option. We feel that's a bad approach. But other than that, we agree if reform is necessary, it has to be affordable. And again, we support about 90% of what's being talked about today.
Okay, thank you. And Jane, what is the latest on this issue right now?
The latest and greatest is, and things move at a very fast speed, and so what I say right now could change as soon as we leave. But Senator Reid has come out recently saying that there will not be a vote in the Senate before the August recess, and so that does shift a few things. First thing is that there's really only one major bill that has come out of committee, and that's the Senate Help Bill, and that got approved, and that is moving forward in the Senate. The other bill that people are really looking to is the Finance Committee bill on the Senate side. That's really going to be the bill that has the most bipartisan support. That's the bill that's really going to direct where the conversation goes, because that's where the money conversation's happening. On the House side, the bills, all of the committees that have over healthcare, there's 3 different committees that have kind of jurisdiction over the healthcare reform bill. They've come together to form what's called the Tri-Committee. And that bill is being held up right now in the Energy and Commerce Subcommittee. And so we're hoping that that kind of moves along. But I think advocates were hoping that things were going to move before the August recess. But now essentially that's not going to happen. And so that puts a lot of pressure not only on members of Congress as they're coming home, but for groups to really put up the pressure onto their members of Congress to give us some answers on healthcare reform.
I think it's worth noting that that bill in the House has been approved by the House Ways and Means Committee.
Okay. And what I would like to do now is talk about what this does mean in the way of a timeline, because we had been hearing over and over again that if this had not been, a decision had not been made by August, it would be a long time before we would be able to address this again. So, Pat, what are we talking about in just terms of time?
You know, I personally believe that reform is inevitable. It will come. I think when you talk about how significant this is, we were talking before the show, we spend about $2.2 trillion on health care annually. That's a huge part of our budget. It just makes sense to us that you slow down, you do it right, and you take some time. I think President Obama he really thinks it should happen now because, as he said, all things are aligning more so than they ever have, and I agree with that. But it is such a huge part of our budget, our GDP. It has to be done right, and I just don't see any reason why we wouldn't slow down and make sure it's done properly and get input from all constituencies, whether you're for particular parts of the plan or against it. I think now's the time that we really need to bring our best minds forward and figure out really what makes sense.
And this is a once-in-a-generation lifetime. Healthcare affects every single one of us. And so I think, we agree with Senator Nelson in his latest letter to Senator Reid was we have to reform healthcare this year, and that it is a once-in-a-generation lifetime. And so we really have to seize the moment. But I agree, we've got to do it right.
Right.
I think it's going to raise a whole lot of pressure on Congress, though, when they come back from recess, because I don't think they're going to want to get into when people start campaigning for midterm elections. And my guess is that you're going to see a whole lot of pressure in Congress to get something done not too long after they're back.
Okay, and that pressure, though, then, Jane, I mean, we're feeling the pressure now. So what's going to specifically take place between now and then?
Well, I think a lot of advocacy groups, including the ones that sit at the Alliance table, are going to have not only healthcare forums, and we do canvassing every weekend, going door to door, talking to our neighbors about healthcare reform, but we're also going to be doing public actions. We're going to be doing a public action in front of the state capitol on August 19th. We're going to be doing a big town hall in Omaha at the end of the month. And so it's really about what we say, the escalation of activities. And so it's more activities more often.
Okay, so we're going to hear about this, obviously,
A lot
more.
as we should.
Yeah, okay, and let's talk a little bit more specifically about this plan. If you could sum it up in a nutshell, Jane, what does this mean for people who are already covered?
What it means for people who are already covered is that they'll be able to keep their insurance. So right now, for example, I have a great insurance plan that has a low deductible and covers my family really well. And so that won't be touched. What it's going to mean is that for the 220 Nebraskans who are losing their health insurance every week because of cost, they're going to be able to get an affordable health plan, whether that's through the private insurance like Blue Cross Blue Shield, or what we're advocating for also is that there is a public option. We'd like to see that public option run by the states and run by a nonprofit rather than the national government, but it's very early in the game to figure out what exactly that mechanism is going to be. But essentially the bottom line is, for everybody, it means more affordable care, more access to doctors.
There's another thing it means for people who are already insured, though, and that is that those who are finding the cost of insurance very stressful, whether it's employer provided or otherwise, are likely, based upon their income levels, to have a subsidy for their premiums, thus making it more affordable. And as Jane suggested, there are, at least in the House bill that's come out of Ways and Means, they put caps on total out-of-pocket expenses for premiums plus copays and deductibles. So it'll have a very positive impact on many people who are already covered, simply because, one, it may improve their coverage, and secondly, it may make it less costly to them as individuals or families.
Okay, Pat?
The only thing I disagree with is President Obama has repeatedly said if you have coverage, you can keep it. There is a provision in the House bill, and it's just out of committee, hasn't been passed, but there is a provision in there that says You can keep the coverage you have, but you can't change it or switch coverage. So the way we read that is if you change deductible level in a current plan to avoid a rate increase or what have you, that once the connector or the public plan goes into place, you can no longer can keep that coverage. You can't change it. You would then have to shift over to the public plan.
I disagree with that. No.
So it's on page 12,
You
Doctor.
would
It's
shift
there.
over to some plan that's in the exchange. You don't have to go to the public plan. And the exchange will have private, and if it happens, we'll have private and public, a public plan.
You know what? You're exactly right. But the difference is that when you talk about a public plan that reimburses doctors and hospitals at Medicare rates, there's no private company that could compete with that.
But in
and that's
fact,
a problem.
that bill calls for negotiations with providers, not price fixing. One of the things, I'm here on behalf of the NMA, and the NMA has said in a policy statement just Tuesday that they are opposed to any public plan modeled on Medicare. But the public plan that is defined in H.R. 3200, that's the bill that's in the House, is not modeled on Medicare. It would establish a public plan that would have to make its way on premiums. It would get no taxpayer subsidies and would have to accumulate reserves just like private insurers do. So what's in the bill is not modeled on Medicare.
Actually, it is. The reimbursement rate is Medicare plus 5%. But I do want to go back to when Medicare was passed in mid-60s, in 1965. The reimbursement rates were at the usual and customary for the industry. And in 6 years, in 1971, the federal government came back in and restricted those payments to providers and hospitals. Right now, doctors and hospitals, when they receive a Medicare payment, it doesn't even cover the cost of actually providing that service. And then those doctors and hospitals, they look to private pay to make up that difference. A study was done recently that showed an average family of four pays $1,800 more a year in premium to make up for the cost shift or the money that Medicare does not reimburse those doctors to cover costs. There's a Lewin study that was done here recently that said if a public plan went in, 120 million Americans would shift from private employer-sponsored coverage to the public plan. And if it's based on Medicare reimbursement, if the docs and hospitals are already looking to private pay to cover the costs that Medicare isn't paying, what's going to happen when 120 million additional Americans go into that system? It's going to cause real problems.
The Lewin study has been pretty well discredited by a number of people who look at the assumptions that they've drawn. And in fact, the CBO is estimating that about 10 million people would enroll in the public plan.
I'm really glad we're kind of having this discussion back and forth, because it brings me to a question as viewers are watching and saying, oh, he thinks this and he thinks that. And everybody has their opinion. You know, we are, as Nebraskans and the rest of the country, looking for the facts. That's how we like to base our decisions. And we get so much in the way of information, and it gets confusing and overwhelming in a hurry, and a topic like healthcare reform hits everyone. And so, Jane, what would you tell folks who are watching and those who have been following this? How do we funnel through and get specifically to the information that we need to make a sound and informed decision?
I think it's really important that you go to websites that are nonpartisan and that have been studying this for years. So websites like the Kaiser Foundation, who is really a reputable source, and you can actually go on there and compare all three of the major bills, as well as compare to President Obama's proposals that he's put on the table. It's one of the best resources that I direct people, because it's not coming from a union, it's not coming from the insurance company, it's not coming from the doctors, it's just a foundation that's been studying healthcare for years. And so the Kaiser Foundation is a really good source. And I think when you read a study, you have to ask who funded that study. So the Lewin study is funded by health insurance companies, and so of course they're going to have a perspective, which they should, because it's their perspective. And you know, there's studies that we cite that are funded by organizations that are really pushing strong on healthcare reform. And so just look at who funds the study, money speaks, and try to use nonpartisan websites when you're trying to get the information that you want.
Another
Absolutely.
good site is the Commonwealth Fund site.
Commonwealth Fund.
Yeah,
Okay.
they especially go into things like quality of care.
Good information to give to folks, because again, this touches everyone, and it's very, very easy to get emotional about it in a hurry. Pat, I want to talk a little bit about those people who have absolutely no coverage
Right.
at this point. And we do have a graphic that actually outlines the number of people that we believe not to be covered, but then kind of goes into some more specifics here. If you could kind of walk us through, Mike Johanns, this was actually found this on his website. So if you could walk through that and then just kind of give your opinions.
Yeah, I've not seen it presented quite this way, but what Senator Johanns is indicating is that of the 47 million uninsured Americans, which the number usually used is about 45 million, but still significant, way too many. 10 million are eligible for some form of coverage. 9 million earn $75,000 or more annually. We call those the invincibles. The 20-somethings, 20 to 30, nothing's going to ever happen to me, so I don't need to buy coverage. I don't know the 10.2 million that don't have citizenship that are illegal here. I would imagine there's a significant number of that 45 million that are here illegally. I've never seen 10.2 million. I just don't have a way to say that's accurate or not. I know there is a percentage in that 45 million number that are here illegally. And then 6 million are eligible for employer coverage. I'd agree with that. I think most people feel that the number of people that are truly uninsured are somewhere between 12 and 18 million. And I think that's an accurate number. And when you talk about healthcare reform, there's a whole bunch of separate agendas, so to speak. Are we covering the uninsured? Do we really have an access problem? I would agree we have an affordability problem, but I would argue with the doctor, as we did before, is that the bills don't go far enough to control costs. There's some elements in there that are vaguely shaped, but there's really nothing in any of these bills that actually controls costs. Let me throw a statistic at you real quickly. We spend $2.2 trillion a year on healthcare costs, actual healthcare spend. And most credible sources estimate about 30% of that $2.2 trillion is on care that's either unneeded, doesn't work, or is redundant. So our point is nobody's really talking about that. Nobody's talking about the 120 million Americans who have a chronic disease like asthma or diabetes or heart conditions. And while we talk a lot about wellness in these plans, nobody's really talking about how do we control those chronic diseases. And so we feel that in order to really have healthcare reform, you have to have some component of guaranteed issue. We support that. You got to have a component where you get rid of the waste, the 30% of the 2.2 trillion, and you got to do something about the other issue as well.
Can I just
Sure,
one thing
absolutely.
on Senator Johanns' number? Any reputable group that studies healthcare will dispute that figure. And Senator Johanns' office said that they got that from the census, which they did not, because the census only tracks the uninsured and the insured, and we actually called the census and they backed us up on that. So we did more research, and he actually got this figure from a Republican consultant. It was a memo sent out to Republican leaders. It's KeithHennessy.com. Anybody can go and look. And Keith himself, who's a Republican consultant, even said that he can't back that number up, that's his best estimate. It was one of their talking points to try to throw off really the urgency and the need for reform. And so I don't think it's an honest discussion point, and I think that people should really look at that figure. And let's just put that aside. Let's just say that there's only 5 million uninsured. We've got to get that 5 million insured because it's dragging down the cost of the entire system.
And we do, as Pat says, have to control costs. And in fact, I disagree with him that that costs are not addressed in the bills. They are addressed in a variety of ways. Not that specific details are laid out, but at least mechanisms and general approaches, and means of turning those general approaches into detailed cost control. Now, another thing we have to be conscious of when we're talking about cost control is that every dollar that is squeezed out of healthcare is a dollar squeezed out of somebody's income. It's 17% of the GDP today. Yep. That means that roughly 17% of the annual wealth production in the United States is in healthcare, and those dollars go into people's pockets. And to the extent we're able to control costs, there are going to be some losers. Now, they may not be big upfront losers, but over the long haul, people are going to be getting paid less. They may be insurers, they may be highly compensated executives, they may be providers. But the fact is that whenever you listen to people, you've talked about how Nebraskans should judge what they're hearing. They should judge the source of the information. What is the motive, or what are the interests of the people who are discussing these things? And those interests may be personal or sector-specific economic interests. They may be political interests. We know there are people who want this to fail, so President Obama will fail. And so you have to listen. You have to listen to what people are saying with a very good eye to where they are coming from and what their real aims and intentions are.
Thank you. Pat, I want to address this absolutely today. You know, this sounds fine and good, but there are people out there, probably more than we even realize, who have lost faith in the system.
I think that's
You know, we're talking about turning over something that is significant to all of us. And we're looking at some of the other things that are governmentally run, and we're thinking, why is this going to be any different? How reinstill someone's faith in all of this, and talk to us about how this is really going to work.
Yeah, you know what? If it's easy, it'd already be done, right? This is why I'm really skeptical of the public plan, because it doesn't go to fixing the foundation of what's really wrong. You think about 40 million Americans are senior citizens that are on Medicare today, and those folks that are working are actually paying for that retiree health benefit now. There's nothing put aside to pay for their care. So what our fear is if you expand basically the Medicare roll by 120 million people, and I had not heard that the Lewin study was discredited, but nonetheless, if you have a plan that is 30 or 40% cheaper than a private plan, it just logic would tell you that people are going to gravitate to that. So until you fix the fundamental tenets, the waste, the chronic diseases, it doesn't make sense to advocate for a public plan until you fix the foundation.
Those things are included in the bills.
Okay.
And private insurance needs to be reformed also. I mean, anybody that has insurance, even if you like the insurance that you have now, which I currently do, but last year when my husband and I were both self-employed, we spent a good chunk of our income on insurance, and it didn't even cover our shots for our newborn. But any of us could tell a story of either that we fought with our insurance company to get something covered that we thought was covered, or that we got dropped because of a pre-existing condition, or we couldn't get health coverage because of a pre-existing condition. So while there's a lot of good that insurance companies do, no doubt about it, they have got to be fundamentally reformed. And there's something to be said that in this economy, that they're the only industry that is showing a profit. So something is going on. And they need competition.
Yeah, the one thing I would say to you though, Jane, and while I don't disagree with most of what you said, Blue Cross Blue Shield is a mutual not-for-profit company. We pay 90% or 90 cents of every premium dollar we receive, we pay back in claims. We have about 9 cents or 9% of that premium dollar goes to administrative overhead, and then we put about 1 penny or 1% in our reserves. So while I agree generally with what you're saying, you're kind of lumping the nonprofits, the not-for-profits like Blue Cross, in with the for-profits where...
I wish all insurance companies would be nonprofit.
Yeah,
we'd be fine with that.
Let's start there.
I think I've heard somebody from Blue Cross Blue Shield Nebraska say that they think all private insurance companies should be nonprofit.
I like that
Very
idea.
recently. Actually, you know, we're talking about insurers are really an interest group. Providers are an interest group, and I have to say I'm really proud of the healthcare professionals in this country, because the AMA, the American Academy of Pediatrics, American Academy of Family Practice, the American College of Physicians, the American College of Surgeons, and the American Nursing Association have all endorsed H.R. 3200. That's the bill that's currently working its way through the House.
Okay. I'm just curious, Pat, how are the governors have been concerned about this. How are the states going to manage this when we're having such a hard time with Medicaid and Medicare? I mean, to me, this seems like it's just going to add.
Great
I know
question.
it sounds like maybe it'll take away, but it sounds like it's going to add, and that's overwhelming to the states all on its own.
Yeah, I agree. And again, I think you can have reform without expanding the role of government. When I was in the legislature, that's just been a few years ago, Medicaid was growing at 18% a year. In 20 years, if we hadn't done anything to control Medicaid spend, it would have been 80% of the state's budget. You know, and that was as recently as 5 years ago. And so why would we think that expanding the role of a government plan, basically expanding Medicare by a significant amount, whether it's 10 million, 20 million, or 120 million that we think it would be, it's not sustainable. So what we're doing is adding more people to a system that even the doctor would concede is broken.
And
Actually,
Governor
certainly.
Heinemann shouldn't wait for federal reform to start reforming our systems now. And so there are clear things that we need to be changing in our state. First and foremost, obviously, the mental health system. And we can all point to lots of things, not only with the Safe Haven law that really showed that, but the Beatrice Center. But there's problems with CHIP enrollment and S-CHIP enrollment and the barriers that are there, the enrollment paperwork. And so I just think that there's a lot of reforms that our governor could lead on currently to help start reforming the system now.
The NMA, as you probably know, developed a plan, a bill, LB 656, that was in our last unicameral session. And it actually addressed all the issues of access, quality, and cost, we think in very constructive ways. And that bill didn't get out of committee, but instead a resolution was passed to set up an interim study, which is to take into consideration those things and work out more detail. Actually, the LB 656 would have set up a group of people to work out the details for a complete overhaul of healthcare in Nebraska. And basically they punted it to a new group, and I think in large part, talking to the committee members, that it was because they didn't know what's going to happen at the federal level, and they didn't want to spin their wheels and then just have it all for naught because there was federal reform.
Blue Cross did support 656. We did,
Yes, they
and we
did.
had input on what was in the bill, and the medical association was very good about that, very collaborative, and we were disappointed as well.
In the very limited time that we have remaining, very limited, just curiously, as it's laid out, would you sign up today?
Yes.
Yes?
Public option?
Yeah. Okay.
Absolutely not.
That's honest and that's fair. We have about 30 seconds. Wellness in this plan. Where is that addressed?
Actually, it's addressed in terms of extensive new prevention efforts that hinge largely or depend largely on incentives and public education, but it is in the plan.
Okay,
And
thank you very
Representative Fortenberry is actually being a leader on prevention and wellness on the House side, and so he should definitely get props for that, and he's going to be holding a town hall in the August recess on that as well.
Certainly something to be keeping our eyes and ears
Absolutely.
tuned into. Thank you all so much for joining us. We appreciate it very much. Thanks
Pleasure
to
to
all
be
of
here.
you for watching. We will see you next week.
Consider This is an issues and information program produced by UNO Television. More information and program archives can be found at unotv.unomaha.edu. If you'd like to share your comments about this show, call UNO TV at 402-554-2516 during regular business hours.
The 12th season of Consider This is brought to you in part by From the Top, a national program showcasing the musical talents of young people. From the Top can be heard on KVNO Classical 90.7 each Saturday at 6 p.m.